Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Golnur Sharif Saleh, providing you with information on aging-related topics. Learn more at geriacademy.com and follow me on social media. Hello, Geri Academy listeners. Welcome to episode number 17, where we talk about different stages of dementia. The reason I want to talk about different stages of dementia, because I think it's very important for people who have a loved one with dementia better understand how each stage changes the way a person processes information and changes care needs. So at this time, we don't have a cure for dementia. And I have said this in other podcast episodes. All dementias progress, and eventually the disease can lead to a person's death. The treatments that we have can help slow down the progression of disease, but they are not a cure. The hardest part of my job right now is informing patients and their loved ones that they have dementia, their condition will progress, and that their condition is terminal. In fact, patients who have severe stages of dementia actually qualify for hospice based on their dementia diagnosis. And I'll talk about that a little bit later. So, my partner, Dr. Marshall, and I have a primary care clinic where we care for patients 55 years and older in Asheville, North Carolina, Golden Oak Medicine. But because we are geriatricians and because we are experts in memory disorders, we also have a memory program. And in our memory program, and there are memory programs all over the country. So if someone has concerns that there might be a memory disorder either for themselves or a loved one, you can look for a memory program. They can offer a comprehensive history, evaluation. They can diagnose the disease process, treatment options, support, and education to patients and their loved ones. One of the biggest parts of our memory program is the support and coaching that we provide to caregivers so that they can keep their loved one at home as long as possible. If we can intervene and help our loved ones take care of their patients and their loved ones better, then, well, let me rephrase that. If we can help caretakers care for their loved ones better and understand the needs of their loved ones, then the likelihood that they will be placed in an institution, a nursing facility, will be reduced, and the time to institutionalization is delayed. There is data behind this. There is literature written on this. So, dementia progresses from mild to moderate to severe. To break down the stages of dementia even more, I use something called the FAST score, the Functional Assessment Staging Test, by Dr. Reisberg. It was developed a long time ago. Decades ago, actually, but it is validated and it helps to break down into 7 stages. Stages 1 and 2 are normal cognition, and there's no sign of dementia. Stage 3 is classified as mild cognitive impairment. This is not dementia, but it's classified primarily as memory problems with the ability to complete day-to-day tasks. I have a blog post on different types of dementias and a previous podcast episode, so I recommend that you look into that. But with mild cognitive impairment, many of these patients go on to progress to dementia. And in our clinic, when we see a patient who has mild cognitive impairment, we can start intervening right away. And so I encourage you, if you know someone is struggling and having some problems with just some short-term memory loss, to look into that, because starting to care about your brain health early on can help keep you independent and at home and help delay progression into dementia. So the FAST stage 4, so like we talked about the FAST, the functional assessment staging, stage 1 to 3, no dementia. Stage 4 is mild dementia. A person with mild dementia can manage their basic day to day activities. These are called their activities of daily living. And that includes they can feed themselves, they can transfer, so get around the home, they can toilet by themselves, they can bathe, and they can dress themselves. Persons with mild dementia start having difficulty processing more complex tasks, such as shopping, driving, managing finances, cooking, cleaning, and those tasks are referred to as instrumental activities of daily living. Generally, a person who has mild dementia recognizes that there is something wrong. They may feel defensive and try to hide their disease. A person with mild dementia may process information around the mental age of 8 to 12. They will still have some safety awareness, but loved ones need to monitor closely to ensure that person is safe. Usually, a person with mild dementia can still live by themselves. At this stage, a person may need a driving evaluation if they insist on driving. Consider reading my blog post on driving and aging, which also discusses dementias and driving. And you can read that blog post on jerryacademy.com. Moving on to moderate dementia. Moderate dementia is a fast score of 5. Individuals affected start having difficulty managing more instrumental activities of daily living. So they may need help selecting their clothing. They may start having problems preparing meals, forgetting to take baths, not paying attention to other personal care needs. A person with mild dementia is generally no longer safe to stay by themselves and needs continuous supervision. So, individuals with moderate dementia should not live at home independently because safety awareness is likely poor by this stage. Individuals with mild dementia may process information, with moderate dementia, may process information at the mental age of about 5 to 7. Consider this when I say processing information at a specific mental age, that doesn't mean that's how old the person is acting. All it means is processing information. So they are still an adult and respect is needed, right? You need to respect them because they are still adults. Individuals with moderate dementia may have more difficulty comprehending instructions. So, in comparison, a person with mild dementia, you could probably tell them, hey, can you help me set the table? A person with moderate dementia, you may need to break down that task into multiple parts. Can you take these dishes to the table? Can you take the silverware to the table? Patients with moderate dementia can start to develop behavioral problems also, such as anger, agitation, physical or verbal abuse of family members, and they may start to wander. The next stage is moderately severe dementia. This is a FAST score of 6. So by the time we get to a FAST score of 6, there's a staging breaks down into 6A to 6E. And patients with moderately severe dementia start needing help with basic daily needs such as putting on clothes, toileting, transferring, bathing. They may begin to experience urinary and bowel incontinence. Patients with moderately severe dementia may be processing information at the mental age of 2 to 5. So remember what I said. They are not acting 2 to 5. They are processing information at the mental age of 2 to 5. So what does that mean? If I ask a person with moderately severe dementia, if you needed help, what would you do? They may not be able to say, well, I would call 911 or I would call my family member. They may say something totally different. I would step outside. Okay, what would you do if you stepped outside? So those are the things that I'm talking about. These individuals can no longer be left alone under any circumstance. So, a person with moderate dementia may be okay for 30, 45 minutes by themselves, but a person with moderately severe dementia cannot be left alone. They need constant supervision. And this is usually when patients start to need placement in a facility. But again, When we have memory programs, for example, our memory program, we can help instruct family members and loved ones on how to set safety measures in place to help keep their loved one at home longer. The next and last stage of dementia is severe dementia. This is a fast stage of 7, and this also goes 7A to 7E. And generally, when someone is a fast stage of 7C, and I say this so you can remember, in the United States, they qualify for hospice care. And that doesn't mean that they're going to die right away, right? It just means that statistically speaking, they are so frail and they are so ill that most patients with that stage of dementia, a fast 7C, may not have more than a 6-month life expectancy. And I have seen patients with severe dementia actually live longer than that, much longer, 2, 3 years longer than that. Dementia is a very personal disease, and for everyone, it progresses differently. So, persons with severe dementia may no longer smile, speak, walk. They have difficulty holding themselves up in a chair, difficulty swallowing, and may stop eating. In the later stages of severe dementia, patients start to sleep and drift off. And like I said, are eligible for palliative care and hospice services. Generally, patients with severe dementia are processing information at the mental age of 1 to 2. They really can no longer participate in life. Due to the progression of the disease, patients with severe dementia are at risk for dehydration, malnutrition, developing pneumonia, and pressure ulcers and infections. When there is no function to preserve, a person with severe dementia will continue to decline and eventually die because of their dementia diagnosis. So, one of the other things that I do and I have done is palliative care and talking to people about end of life care and helping people when they are at the end of their life. What I want to say about dementia, severe dementia specifically, is this. When someone has severe dementia, it's important to help you understand that because this is a terminal illness, and when someone has severe dementia, the likelihood that they will pass away is high. Family members and loved ones need to prepare for this. A person with dementia that is severe will get dehydrated, malnourished, develop pneumonia, develop pressure ulcers, develop infections because they're no longer moving around. They are no longer participating. They are no longer eating. They are no longer swallowing their food safely. And so, as they start to develop these infections and they're dehydrated and they're taken to the hospital and given IV fluids and then come back home and back again, this revolving door of in and out of the hospital starts to happen until the person dies. And usually, this individual dies at a place, so in the hospital, where they don't want to die. And family members have been grieving the loss of this person through this severe dementia stage because this person is completely shut down. So, what's important is to, again, realize and think about this. If you have a terminal illness and you're at the very end stages of the terminal illness, it might mean that your loved one is ready to pass away rather than going back and forth into the hospital. And what I often see is that we are now prolonging death rather than giving that person quality of life or any meaning to their life. So, every individual goes through the stages of dementia differently. The disease course can vary from just a few years to over a decade, depending on overall health, other disease histories, type of dementia, and likely other factors such as environmental factors. Providing education and support is crucial. Speaking to your healthcare provider for more information, getting information off of the Alzheimer's Association website, which is awesome, the Centers for Disease Control, and the National Institute of Health, which has wonderful books to look at and great resources, can be helpful. And so if you live in Asheville and you're looking for someone to do a memory evaluation, we are there. There are also a couple of other great resources in Asheville. If you are somewhere else listening to this podcast, look up a memory clinic, because the way a memory clinic functions is very different. Usually, assessments in a memory clinic take 2 to 3 hours before an actual diagnosis is provided to a patient. And not only a diagnosis, but a plan of care. And that plan of care can keep loved ones out of nursing homes or delay getting admitted into a nursing home and help them stay at home longer. That is all I have today. I hope you enjoyed this episode. Have a great day. Thank you for listening, and share Jerry Academy with someone you love. Thank you for listening to this episode of the Jerry Academy podcast. Learn more at jerryacademy.com or follow me on social media for information on future episodes.